Randy Luby, would you like to lead the Pledge of Allegiance?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, welcome to the August 24th Board of County Commissioners. On my left is Commissioner Aaron Mays, who represents District 3, and on my right is Commissioner Kevin Cook, who represents District 2. I'm Bill Rippon, and I represent District 1. And what do we have on first?
First item is item 3, consent agenda.
I move that we approve the consent agenda.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business A, County Clerk number 1, consider all voucher payments.
Commissioners, this morning we have vouchers that total $7,373,052.58. And it's going to take just a little bit to go through all of these. We had under pooled cash, debt service, 911 telephone, event center, and lease purchase projects, and we have a total of $5,736,640.66. And those are the payments on the COP, including the $2,433,536.42, which is the PBC debt for the event center improvements. Under payroll, we have $617,765.62. Under building maintenance, we have $147,254.86, of which the majority of that is Senny and Company for the Hillcrest Community Center remodel. Under bridge, we have Finium Turnip Seed for $50,000, which is the construction and inspection phase of the Southeast 29th Street Bridge over Deer Creek. Under the health allocations, we have $174,576.94. And then finally, under equipment, we have $126,564, of which that is the majority is tailor-made, which is the safety surface at Austin Park, Eastboro Park, and Eastgate Park. I don't have any questions regarding the vouchers and would move for their approval.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item A2, consider correction orders.
I will move for approval of the correction orders.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B, Stormont Vale Event Center. Number 1, consider approval of request to utilize the Stormont Vale Event Center capital outlay account to pay custom sheet metal $13,000 excuse me, for repairs to the Land and Arena and Exhibition Hall chilled water system.
Good morning, Commissioners. Kellen Seitz, Inspector of Energy Management, Stormont Vale Event Center. The request before you today is a capital improvement repair of our chilled water system. Over the past month and a half, we've had some repairs needed on, in particular, chiller number 2. Those chillers, chiller 1 and 2, are primarily original to the construction of the facility, with chiller 1 being replaced about 7 years after the opening of the facility. So this repair, we do have a service contract annually with Custom Sheet Metal to take care of these repairs. This repair has been approved by the Stormont Vale Event Center Advisory Board.
Any questions?
I have no questions.
Nope. I'll move to approve.
Second.
Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B2, consider approval of request to utilize the Stormont Vale Event Center capital outlay account to pay $9,117.31 for repairs to the Exhibition Hall men's restroom plumbing service fee.
Good morning, Commissioners. Kellen Seitz again, Inspector of Energy Management, Stormont Vale Event Center. This item before you is a bit of a housekeeping item. This item was approved by our advisory board back in March, though Through our closure and the pandemic, it never got on the agenda for repair. This capital repair is in specific relation to the exhibition hall men's restroom. We had a plumbing failure in there. One of the pipes collapsed, so this capital expense repair is for the repairs of that, as well as the resurfacing of the new flooring surface in that restroom.
Any questions?
Nope. Move to approve.
Second.
Motion's been made by Commissioner May, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you.
Kellen. Next item.
Item C, Parks and Recreation. Number 1, consider approval of request to seek bid for a 3-year period starting in 2021 for the purchasing and restocking of rainbow trout in Lake Shawnee twice a year, 7,000 pounds in the spring and 7,000 pounds in the fall, with the Kansas Department of Wildlife Parks and Tourism reimbursing Shawnee County for the cost of the trout.
Good morning, Commissioners. Tim Laurent, Shawnee County Parks and Recreation. Yes, as Ms. Beck stated, we're asking to go out for bid for the trout stocking at Lake Shawnee. It is 14,000 pounds of trout per year, and I'd be happy to answer any question that you might have.
Mr. Chairman.
Yes.
Tim, this may sound like a silly question, but I know that it's a big issue for the fishermen. Are you going to be focusing on weight or quantity of the fish?
You know, I believe, and I wish that I had somebody here, maybe Randy might know, but I think there's some specifications on there about about so many of the fish need to be above a certain weight. I remember hearing about that. I don't have those specific details in front of me, but I think they do try to ensure that a certain number are over a particular weight.
Well, I know that it's an issue in the past if you buy 14,000 fish at 1 pound
Yeah.
versus buying,
I can tell you this, I've gone out and watched 2 of these when they feed them into the lake, and they're not 1 pound. These are big fish. By and large, I would imagine they're all, a couple of pounds or more. I mean, they're large.
What kind of trout do they put in? You know what species of trout they
I do not know that.
Rainbow?
Yeah, I think it might actually be in here.
it's
Yeah,
in
rainbow
rainbow.
trout.
Okay. Any other questions?
I just know that that's been an issue in the past, and so, I know that the trout fishermen like to see some of the bigger fish, especially if we're looking at any competition or the tagging.
Sure. Well, I would encourage them to come out and watch the stocking process because, we do have our staff out there. We use nets. We allow the kids to actually get up close and touch the trout before they go in the water. And there's also a period of time where they enter the water where they're a little bit listless. They just sort of float around right in that general area, and staff are out there actually kind of helping them get going, and then all of a sudden they'll take off. So you can get a really close-up view of the size, that day. So I would encourage anybody to come out if they were interested.
I'll move for approval.
I'll second. Motion's been made by Commissioner Cook, second by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you.
Tim. Next item.
Item D, Weed Department. Number 1, consider approval of request to issue a request for quotations for the purchase of 2 roadside spray units with funding from the Weed Department Capital Outlay Fund.
Good morning, Commissioners. John Landon, Director, Shawnee County Weed Department. Before you this morning, I have a request to go out for bid for 2 roadside units, spray units. In March, we came before you for the lease of 2 one-ton spray trucks, and these would be the units that go on those trucks. Both units will be equipped with Raven controllers that have ground sensing technology on them. We'll be able to pinpoint exactly the acreage that we're applying now. So how things work typically is the faster you go, the more you put down, the slower you go, and so this will even that out. It will calibrate to the speed of the truck to do so. We estimate that these sprayers will last 2 life cycles of the truck, about 10 years or so. And I will answer any questions you might have.
Any questions?
No. I'll move to approve.
I'll second. Motion's been made by Commissioner May, second by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item D2, consider approval of request to contract with Verizon Wireless for installation of monitoring equipment and services for 6 spray units for a one-time equipment and installation cost of $720.82, with funding from the Capital Outlay Fund and a monthly monitoring fee of $115.14, utilizing the departmental operation budget, and authorization and execution contract C-296, 2024, same.
Good morning, Commissioners. John Landon, Shawnee County Weed Director. The second part of this is equipment to monitor the spray units on those trucks. This will pinpoint exactly where we apply herbicide at throughout the county. I would stand for any questions you might have with that.
Any questions?
I'll move to approve.
Second.
Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you, Commissioners.
Thank you. Next item.
Item E, Commission Number 1, consider resolution number 2020-49 that will incorporate the latest health order.
Good morning, Commissioners. Jim Krause, Shawnee County Counselor. You will recall a few meetings ago, the health officer issued a new order, and then we followed with a resolution that provided amendments for the closing times for bars and restaurants. That is a process that I'm going to recommend going forward when a new health order is being issued, that we follow it the next meeting with a resolution to put over the top of it for legal reasons. I prepared 2 versions following the recent health order that was issued on the 21st by the health officer. One version, which I'm going to pull up in front of you, simply reaffirms the change we made last meeting when we addressed these issues by keeping the closing time for bars and restaurants at midnight. The remaining balance of the resolution would simply affirm the latest changes in the local health order, and I'd be happy to try to address those changes that are in the new health order if you'd like, to the extent that I understand them. The second proposed resolution that I made does the same thing, brings forward the changes for the closing time for bars and restaurants that we approved last time we did this process, and it adds a statement that says this: this resolution is not intended to regulate public and private schools. Schools are encouraged to work with the state of Kansas and the Shawnee County Health Department to determine whether and how to safely open and to safely conduct school-related activities. The intent of that language would be to simply say to parents with kids in schools, if you have questions about whether the school is going to open or not, how they're going to open, whether to wear masks or not, how curricular activities are going to occur. If they're going to occur, you would need to go to your school to get the answers to that question. As we have discussed, life is confusing enough right now without having multiple layers of regulation, and the intent of that language would be to make it easier for parents to know not to come to the county commission for those questions, but to go to their schools for those questions. And I'll be happy to answer any questions you might have at this point.
Jim, is that the only difference between the 2 resolutions?
Yes, that's the only difference between the 2 resolutions that I've drafted for this morning's meeting.
The resolution talks about the 3 extra hours for the bars, right? What are the other restrictions?
The other changes that were issued, which this order would affirm, was a change to the public gathering limit, from reducing the public gathering limit from 2,000 to 500, leaving the outdoor mass gathering limit the same at 45, and lowering the indoor gathering limit to 25.
At 25, could you have a classroom of a lot of your class?
With
but
the
with
language
with that
that
language,
I've
then-
proposed,
Okay.
the answer to that question would be contact your your school, and they will tell you exactly how they've determined how they're going to safely open and whether they're going to have in-school class.
What if you have an indoor facility where you can space out, you can have social distancing?
We get questions on that a lot. The 25-person gathering limit is for a gathering that cannot socially distance.
Okay.
If you can socially distance, you can have more than the 25.
Okay. Any questions?
No, I would note that Dr. Pizzino is present, and so if there are any questions regarding his order, you might be able to direct them to him.
Yeah, I will state that's my interpretation of the changes. There may be more things that he believes are significant in there that he would like to address.
Is this change based on number of new cases, or what's the?
I think that's probably a question, Mr.
We're
Chairman,
not-
for Dr.
Yes.
Pizzino, if we wish to have him
Sure.
maybe address why. Mr. Chairman, also if Dr. Pizzino can also address our new meeting space and if it fits better with his interpretation of needing to be spaced out.
Good morning, Commissioners. Gianfranco Pezzino, Shawnee County Health Officer. So the changes were prompted by a variety of factors, all pointing to the fact that we have had an increased level of transmission of the virus in our community for several weeks. So we had 3 weeks in a row of increasing the number of cases. We have a fairly high percentage of positivity. We had, last week we hit our record highest number of cases reported in one day. I don't remember which day of the week it was, but it was close to 50 cases in one day. We have a high percentage of cases for which we do not know where the infection was acquired, which means that people just get it, and we just don't know exactly where it is because there is so much virus going around. We have a number of clusters of cases, of small outbreaks, including several in nursing homes, and that's obviously a reason for concern for us. But not just nursing homes, we have outbreaks just about any place you can think of in our community. We have private businesses. We have multiple cases linked to bars and restaurants and sports events, and we had a few cases in schools already, even though schools have not reopened for the students. We had a few cases related to athletic activities. I mean, it just goes on and on and on. So our experience actually is mirroring the one of the state as a whole, or at least many different parts of the state. So we thought it was time to do something a little more effective, hopefully, in trying to reduce the amount of disruption that this virus is really going to cause. It is already causing. I mean, sometimes that gets into the news, other times it doesn't, but there are businesses that are forced to close for a certain number of days because their employees are either sick or on quarantine. The number of hospitalization has also gone up. Last time I checked last week, we were, I believe, above 20, which I don't remember if we were ever above the number in the past, but it's pretty high. Hospitals are concerned that the occupancy level of their beds is very high, and especially heading into seasonal flu season, that's a reason for concern, because we know that there is more demand on hospitalizations once the flu hits. So that's the reasoning behind that. We try to adopt precautions that are hopefully going to be effective while being as little disruptive as possible on social activities and things of that nature. Now, the question about the small gathering, I don't like that event. Unfortunately, it's one that we inherited from state documents and plans. But essentially, that's a group of people that get together and are not really parts of the same household. So by getting together, if they do not follow social distancing, of course, if one of them is infected, one or more of them are infected, they can transmit the infection with each other. That limit of social gathering used to be 10 per state plans, and then it increased finally to 45. It has been at 45 for several, I think at least a couple of months probably, starting when we moved into phase 3. We reduced that now to 25. Essentially what that means is that you can have up to 25 people who are in close contact with each other. If you have additional individuals in an indoors environment, you can have them as long as you do not go past the 50% occupancy level of the place, as long as the people, in addition to the first 25, are 6 feet apart from the first group. So you can think, for example, of a public event in a venue that contain 3,000 people. You could have up to 500 people in groups of 25 or less, and each group is separated from any other group or any other individuals by 6 feet. The tricky part, though, is that you should not allow people to move from one group to the other, because that would defeat the purpose. The purpose here is to keep people separated. We know how this virus is transmitted. It's primarily through crowding environments and close contact among individuals. And so that's really what the limit of 25 people means. We did not change the limit for outdoors activities in recognition of the fact that there is less risk of transmission in gathering outdoors than there is in gathering indoors. Does it answer your question? It was a little hard to hear in the back, so I'm not sure exactly if I have addressed your question or not.
With our new cases, how many of them are in nursing care facilities? Would you say half of them or more than half?
I don't know, Commissioner. I hate to throw a number there based on my guess. I can tell you that we had about 120 cases in nursing home facilities over the last 3 or 4 weeks, and I can't tell you exactly what proportion that represents of all the cases.
I would think that would be our most secure operation in the whole city. I mean, they don't allow visitors. I'm sure they're wearing masks. Is it coming from work? It has to come from the workers. It can't come from within, I don't believe. How's that happening?
Well, a couple of things. First of all, most nursing homes had moved into a reopening phase when we were trying to reduce the level of precautions throughout the entire community. That applied also to nursing homes. There are some documents from the federal government that they follow, and so visitations in most cases was now allowed, for example, and taking residents outside within certain limits that was allowed. One of the things we did, which is not included in the order, but we issue a notice to all our nursing homes on Friday also, either Thursday or Friday, advising them to reverse back to their phase 1, as we call it. It's called in the federal government documents of reopening. What that means is restricting again visitation and communal activities within the facility and excursions or trips outside. So that's the first answer to your question. So they were not really in lockdown. Most of them should be by now, given the communication we gave them last week. The other part of your question, does it come through employees? From what we know, in a lot of cases, that's the case. In a lot of instances, that's the case. And the reason that it's really hard to prevent is that because we have so much virus in the community, we just cannot keep the nursing home bubble separated from the rest of the community. So we have people who have their lives. They work in a nursing home. People are in a nursing home because they need nursing care. So obviously there is a very high ratio of employees to residents. There are, in many cases, there are actually many more employees than there are residents in a nursing home. Those employees have their own lives. Our society, our community right now is not in lockdown. People go out, people go and socialize with each other, people have parties, people have multiple jobs. We have instances of nursing home employees who work in multiple nursing homes at the same time. People have multiple jobs Between a nursing home and other settings, we have an example of somebody who was working in a school and was also a nursing home employee. So I'm not saying that to say the nursing home employees are bad and are really doing something bad. It's just the nature of the business. When you live your life these days in Shawnee County, just as well as in the rest of the state and many parts, most parts of the countries, you are exposed to this virus. And there are some chances that you're going to take the virus with you anywhere you go, including the nursing home if that's where you work.
Are they tested more than, how often do they test their workers?
Yes, they're doing a lot of testing, and there are some protocols that both the federal government and KDHE issue. So some of the nursing homes that are most heavily affected right now, they test everybody once a week, everybody who was negative. Those that are positive, of course, we know they were already positive, but those who were negative are retested every week. And the idea is to keep going until the number of positivity goes down, ideally to zero.
Is there anything we do as a as our health department, do we do anything to help prevent the spread in the nursing homes?
Oh, absolutely. We have, since the beginning of the pandemic, we have assigned, first it was one person, and then we added a second person, staff at the health department, whose only job is really to keep connections and provide advice and technical assistance to nursing homes. In addition, we are in constant communication with the nursing homes that are experiencing clusters of cases. Typically, we have at least 1 or 2 conference calls a week with some of those nursing homes. We have correspondence by email. The most recent example was last night. I was having a long correspondence with one of our facilities, and they have some questions about their residents. So we are trying everything we can. And honestly, I was surprised that this didn't happen before, because I know the nursing homes are a very vulnerable place for infection, and they include very vulnerable individuals. And so the fact that we were able to delay this event until now, I wouldn't say it's a big satisfaction, because now we have it, but we definitely did everything we could to prevent or delay that from happening.
I just reading statistics, it looks like the average age of someone who dies of this virus is like 77. So that kind of points to your vulnerable crowd. But along that same line of thinking, has anyone under 20 died from this virus in Kansas?
I don't have that data, Commissioner. Are you saying Kansas?
Yes,
or?
in Kansas.
I can get back with you. I don't have that data right now.
Well, I just, with people sending kids back to school, I think maybe that's a good statistic for people to know. Because I haven't heard of one. I haven't heard of one of that age, and I think when creating public policy, that's a good number to have. That people need to know that, sending your kids to school is not, if they get the virus, it's probably not going to affect them that much.
I would argue, Commissioner, that that's not the most important statistics for people to look at. I think there are other statistics, and that's why we have our dashboard and our scorecard now that look at the impact of the disease as a whole on our community. And that impact is measured not just, and I would argue not essentially, not primarily, in the number of deaths that we experience. I would also like to add that coronavirus right now is heading towards being the 3rd most common cause of deaths by the end of the year in the United States, second only to heart disease and cancer. So, you may want to count just our deaths in our Shawnee County, but we don't live in a bubble, and our deaths may not have been elevated, although we did have 2 more deaths last week, so the thing is real. But there are other measures by which we can measure the impact of the virus, and that impact is pretty profound right now.
I just think it'd be reassuring to people, school-age kids, what their risks are. I think that would be good information to have. And
Mr. Chairman?
Yes.
I might just ask, because as a parent of 2 school-age children, one as a high school freshman and one as a 4th grader, yes, my children may have a lower impact of the virus, but the concern, as reported by our national medical societies, is what will they pass on to the parents or other adults. And so as an adult, I think this is where the teachers, the parents, the workers are all concerned is what will be the impact from the children returning to school. And Doctor, your thoughts on that?
I think we need to look at the whole picture. It's not just about the children themselves. There is growing evidence that children are in a most favorable position than people of older age, for example, when it comes to the virus. At least in certain age groups, or when we say children, that's also a little caveat. Children goes between 0 and 18. As you can imagine, there is a lot of differences here. But just to make a broad statement, they tend to be infected less often. If they are infected, they tend to be infectious less often. And if they become sick, they tend to develop symptoms less often. And if they do develop symptoms, those symptoms are severe less often. So when you put everything together, definitely, if you could pick an age group to be in the middle of this pandemic, I would pick one of those, pediatric age groups. Having said that, everything is relative, so less often doesn't mean never. So in fact, we had a death in Kansas just last week in a 6-year-old. So things can happen. So that's one part. The risk is low, but it's not zero, and people need to know that. The other part is, Commissioner, what you were referring to, is that children, unfortunately, can act as amplifiers, even though, again, it looks like they may be infectious less often than some other adults. They're not super spreaders, usually, as we call people who infect a lot of other people, but they can act as a source of infection for other people in the school setting, so staff and teachers, and other people at home. And that's really a big concern. I know that people who work in schools are very concerned about that kind of interaction. That's why we have to take all those precautions. That's why there is a requirement or a strong recommendation for use of masks in schools and social distancing and the likes. It's not just to protect the children, it's to protect everyone else who is in contact with them.
Mr. Chairman?
Yes.
Doctor, the chairman had asked what was the reason for the change in the gathering from 2,000 down to 500, the changes in the gathering size, and you had touched upon, the chairman asked if it was just in result to the hospitalizations or the recent increase, which may be related to our older adult facilities. But as a health officer, are you looking primarily at those factors or the transmission rate?
We are looking at multiple factors, and probably the easiest answer from me would be to refer you to the scorecard that we released last week, which includes 6 different measures, one of which is the stress on the hospital system, and other is the stress on the public health system. But the other measures are number of new cases, percentage of positive tests out of all the tests that are performed, whether the trend in number of cases is up or down, and the percentage of new cases for which we do not know a source of infection. So those are the 6 factors that we consider. And so we look at everything together, and then what we develop with the scorecard is actually a scoring system. So we even have a quantitative number that we can use to track our progress. And I think that's really going to be the main, our main element to guide us in the future decisions on whether these precautions are sufficient, whether they're excessive, and we can relax some of them, or whether they're just about right. We want to move, right now we have what we call the orange zone, which is the second worst zone where you can be, and we want to move definitely into the yellow zone for at least a couple of weeks before we can say we are doing better.
What's our percentage of positive cases of the people we test? You know,
Right now we are averaging about 8%.
8?
8%.
Okay.
Which again is considered too high. It's not the highest. So if you look at our scorecard, anything of 10 or above will place us in the red zone. So we are now in the orange zone. Anything below 5 would be ideal.
We started wearing masks a couple of weeks ago, and yet our rates are going up. Are they just not working, or do you credit it to something else?
What is not working, I'm sorry.
We've been wearing masks now, we've been kind of under.
Oh, the mask. I think the masks are working. I think the masks are working. They're working in two ways. I think the resolution that the county made is working in two ways. Number one, I see a lot more people wearing the masks than before. Number two, we know that masks work. I mean, we don't know exactly. I can't tell you how many cases of infection were prevented in Shawnee County, but we know there is just an overwhelming volume of evidence that masks work. The problem with masks, though, are they're only one out of many elements of protection that we can institute. There is no one action that we can take that will prevent the transmission of this virus 100%. And that, frankly, will be true probably also after we get the vaccine, from what I hear. Unless we get a vaccine that's 80-90% efficacious, which almost never happens. So mask is just one of the layers. The second layer, which I think it's just at the same level as mask in terms of importance, is social distancing. So keeping people 6 feet apart and having them wearing masks, that in and of itself, some estimates say that it can cut down up to 70% of transmission. Again, those are national studies. It's not something directly related to the cases in Shawnee County. So I wouldn't take this as a sign that masks are not working. I can tell you, if we were not using masks and did not have those precautions in place to limit the size of gatherings and such, our number of cases would be much higher.
I noticed in the paper the other day, I think they quoted you as saying we could have 2,000 deaths if we didn't follow some precautions. I can't remember the exact words, but did you read the article?
I'm not sure which
Okay.
one. I read many articles. Honestly, I'm not sure which one you are referring
Okay.
to.
I was just wondering what that was based on. All right. Any other questions?
Yeah, I do. We talked a lot about nursing homes. Do we feel like we're starting to get that under control? The nursing homes, I mean, are the cases still going up tremendously? Or are they active cases now and the rate of transmission slowed down quite a bit? Or
I think it's too soon to tell, Commissioner. Part of the problem is that most of these cases are asymptomatic, so they do not show symptoms. So the only way we know how many more positive cases we have is when we test them. And so different nursing homes are doing the testing on different schedules. So I would say for now, I haven't seen any big evidence that this is totally under control, and it also varies very much from one place to another. There are places that have been able to bring down their number of positive results considerably. Other places are still struggling, so it's a kind of mixed bag still.
okay. And then at some point, are we ever going to do any community testing where we take, a random sampling of folks to find out, what exactly the real community spread is? And, I mean, because we're still not testing asymptomatic people other than in an outbreak, right?
Right.
So, I mean, is that something that we're thinking about doing, or?
So typically, community testing can be done in two ways and for two different purposes. One would be to identify people who are infected at that point in time. That's, I think, the example that you were giving. That is usually not recommended because of the limitations of the test that we have, and also, frankly, would be a massive undertaking. But primarily, the limitation of the test is such that if you test somebody today, you only know if somebody is infectious today or isn't being infected, even though maybe they're not infectious yet. And in some cases, you don't even know if they're infected because they may be infected, but it takes a few days for the test to turn positive. So if you test them during the window, they may still test negative, and yet they're already infected. So the usefulness of this is a mass deployment for diagnostic purposes is quite limited. We use testing of large groups of people, including asymptomatic people without symptoms, in select settings. For example, if we have several cases linked to a work site, and we have a suspicion that there may be more, just because of how the dates of onset are distributed of those cases, it's unlikely. If it looks unlikely that they may all have gotten the infection from the same individual, then we would do a round of testing of everybody around those, let's say, 3 individuals, for the sake of an example, and see how many more positive, if any, we find. So those people are by definition asymptomatic, they're not sick, but we would test them to see if any of those could be recognized as a source of infection for others. So that's the first example of large scale testing. The second example is when we take a sample of our community, our population, ideally a random sample, and we test them for antibodies. So now we are not looking for an active infection. We are looking for a sign that there was an infection sometime in the past. Anything, and people are still debating what in the past means, but anything probably between 2 and 8 weeks, something like that, maybe even longer than that. Those are called sero surveys because they're done using serum or blood. And I know that the Kansas Department of Health and Environment is planning something statewide, at least in the large urban areas, including Shawnee County. And it's a pretty big effort. It takes good resources, it takes good design, because if you want significant data, you must have a random sample of people. But I would be very interested in seeing that data once it's released. It's not something that within the reach of our resources.
So it's my understanding the Community Blood Center is doing antibody testing on blood samples when people donate blood. Have they shared any of that data with you guys about the number of folks that they've found that have the antibodies?
I haven't seen any data. That's actually a good question. We can follow up with them, yeah. Okay. I haven't heard anything either for Shawnee County or the statewide that would be, if the data is if the number of cases or tests are large enough, that would be interesting data. Although, a little word of caution, that's not a representative sample of the community, of course. People who donate blood are not necessarily representative of the community at large.
Dr. Petzino, how long does it take to get results back from our tests that we're giving?
So how long it takes to get the results back, it's also very variable, and variable for 2 reasons. Number one, it depends on the type of test. Number two, it depends on which week you ask me. If you had asked me 10 days ago, I would say it's pretty bad. We are looking now at 5 to 7 days. And you may or may not remember, I hope you do remember, but a few weeks ago I showed you a chart that was meant to show why it is so important to be timely in our investigations, because if you wait too long, then by the time you identify your contact, the contacts of a case, it's too late to do anything. These people may already have infected other people. The situation in terms of delay from the labs now is a little better. The state laboratory, I think, will process most specimens between 24 and 48 hours, rarely a little longer. Commercial labs, of course, vary depending on which lab you are sending your specimens to. The other part of the answer to the question is it depends on what kind of test you do. And there is a lot of talking about rapid testing. Rapid test really doesn't mean anything from the technical point of view. It only means you get the results typically within hours. That's my definition of rapid. If you have to wait overnight, then you're falling already within the time frame of regular laboratories. But anything within the hours of while the person is waiting in the waiting room of the office, that would be a rapid test. But the confusing part is that there are different types of rapid tests. Some of them use the same technology that we use for the standard nasopharyngeal swab, which is called PCR, and except they have different machines, different equipment that can get your result within 30 minutes to a couple of hours. And those are great because, of course, that's the ideal situation that you want to have. You want an accurate test, like the PCR, that can give you a result very quickly. Other rapid tests use different technologies, and some of them are called antigen tests. Instead of detecting the genetic material of the virus, like the PCR test does, they detect some antigens that are on the coating of the virus, on the outside shell of the virus. If that antigen is detected, then the result is usually pretty reliable, and you say that the person has a current infection. But if that antigen is not detected, then you need to follow up with a PCR test to confirm it. And the reason is that in some cases people are infected, but it takes a certain volume of that antigen protein to be around for that protein to be detected by the test. And so that what we call the false negative result rate is pretty high on the test. And I'm a little concerned that may become a little confusing, especially now the school is starting. I know there are places in Topeka where you can get a rapid test. In many cases, just for the general public, the rapid test, what it means is antigen test. And a negative result for antigen test needs to be confirmed by a PCR. And I hope that the providers explain this to their patients very clearly. Because the risk there is pretty great. You tell somebody, oh, you're negative, you're good to go, and that person may be infected and become symptomatic and infection a few days later. Say, well, I got tested and I was negative. Well, didn't go through the entire procedure.
Is that the saliva test that
No.
we keep hearing about? Or?
No. The saliva test is yet another confusing part. The saliva test is great. It's actually a PCR test.
Okay.
Except instead of using an nasopharyngeal swab that goes into your nose, you use regular saliva. And as you know, there was one new test that was developed and licensed for use last week, developed by Yale University, but now can be used also by other labs. That is going to be very helpful. It's not going to be a revolution in testing because you still need to send the test into a reference lab. So you are facilitating the collection process, but you still have those bottlenecks at the lab where they need to receive the specimen, they need to process, they need to get the results back, and so that's where a lot of the delays take place.
Of people who are tested positive, what is the recovery rate? What percentage of people recover that are tested positive?
The vast majority of people who test positive will
Would you
recover.
say like 99?
I can tell you the number that's on our dashboard. I can't tell you the number exactly. Although there is some concern now because there is some evidence, still preliminary, that there may be long-term consequences of this infection. So, people, when I say people recover, they recover from the acute symptoms. It's still unclear, and in fact, there is a growing vocal number of former COVID-19 patients, especially for places that were hit very hard, like New York City, who are getting together to make their stories known, and they're saying, we are not back to the persons we were before. And it's not just one or two, it's a growing number. Another reason of concern is that there seems to be the potential for a severe heart condition called myocarditis, which means essentially an inflammation of the heart. And that seems to affect disproportionately young, apparently healthy individuals, including people who play athletics. And so the American Academy of Pediatrics, in fact, just recently released some recommendations that football players who test positive, before they go back to play, they should be examined by a clinician who should check for signs of myocarditis, because that can be a fairly serious condition.
All right. Any other questions?
I apologize, but sitting back there was hard to hear. Would you mind summarize again the second version of the order and how that will affect schools?
Good morning, Jim Crowell again. Yeah, the second resolution has a paragraph that says, this resolution is not intended to regulate public and private schools. Schools are encouraged to work with the state of Kansas and the Shawnee County Health Department to determine whether and how to safely open and to safely conduct school-related activities.
Jim, could we make a motion at this time to adopt these resolutions?
You can make a motion at any time. Yes, sir.
Sir, is there no public opinion that we can express?
Mr. Chairman, we would have the ability for public comment.
Tell them what the process is. Tell them what the process is.
We would
have
have
to
the,
make a motion, and
we
then they
we
ask.
we would allow public comment.
Yeah, we typically will make a motion.
Motion
and then
first.
we'll have discussion on the motion. This is nothing unusual.
Okay. You have any comments?
I would say that I think that the second version with the the school language, I think makes sense. The schools, I think, have made a lot of effort to work with our health department to come up with plans. And I'd hate for them to, after they've just started in many cases or about to start, for us to change the way that we're doing things. I know they've worked hard for months to get their plans in place, and I trust that they'll continue to take the necessary precautions.
I think I agree with that. I'm going to make a motion that we adopt the second resolution.
I'll second.
Now, do we want to open discussion, or
We would have our public comment.
any? We'll open up for public comment at this point.
My name is Renee Armbruster, and I'm in Mr. Rippon's district. And I hear all of this comments about the mask, and now we want to go back to 25 people gathering. And this has been going on since January. And I realize we haven't, in Shawnee County, haven't had a mask mandate except for last month, maybe. I don't know exactly what date that went into effect. But one thing I did not hear is, what is the percent of death rates in the last 2 weeks with COVID? And we hear average age of life expectancy, 78. We hear, he didn't even give us a specific number of how many people have been in the retirement homes or healthcare places that died. When a doctor cannot tell you the exact number, and he's at a meeting like this, I question how important this is. 8% of infection is what he said. How does that consider to be a high rate of infection? I could see 50%, 25% maybe. I don't understand how 8% can be a high rate of infection. A virus is a virus, guys. Whether you have the mask or not, it's going to spread, and I'm not even a doctor and know that. Putting off and on and off and on, you're talking to me. Viruses are going to be here. I'm going to get them in my hand. Now I'm going to transfer them, okay? Unless I am constantly putting hand sanitizer on my hands, wherever I touch, I could be liable to get that virus. So I'm just, we don't even talk about the suicide rates going up, the depression going up. We don't even talk about the spousal abuse and calls, marital, the police being called on out to settle arguments. We don't even talk about all the pornography increase. I've had people who own businesses that are never going back to get into business now, because of what our county has done. Shut down the small businesses, but we have allowed to keep the Dillons and the Walmarts and all these other big places open. Why did we do that if it's so deadly? Kansas has less than 1% of people throughout the whole population that we know of. So, there is just so much ramifications to this. And all we focus on is the mask, and all we focus on is maybe the spread. Well, it's a virus. It's going to spread. Like I said, I'm not even a doctor and know that. Is it not our responsibility? You talk about kids going back to school. Oh, well, they could take it home to grandparents. Is it not our responsibility as adults, as individuals? Not the government's responsibility, and you guys are government. We've elected you. You're supposed to be our representatives. But is it not our own responsibility to look at what could keep us healthy, whether it's supplements, whether it's wearing our own mask at home, whatever? We have to take some responsibility, And I can just see the next step saying, oh, well, everybody has to wear a mask in the car or while they're at home with their children, to make sure this doesn't go anywhere, We never did that for the flu, guys, So come on, let's not limit our people anymore. I had to go to a wedding, and we had to take it out of county, and how how much does a wedding bring to a county? Let me tell you, one wedding can bring an awful lot of money with hotels, venues, catering, and all kinds of stuff. Well, Shawnee County lost that money when we took our wedding outside to a different county. So, you know, you can't be tunnel vision anymore and just look at, oh my gosh, the spread of this virus. You know, you have to look at all the things that are happening. We have kids that are scared to death now because they can't even see people's faces. And it's scary, guys, to a little kid. So think about those things before you pass this resolution. I think you need to have more input. I think we need to get rid of everything. Look at Sweden. Look at some of these countries that never did it. Look at South Dakota that never did it. And some of their cities are as big as Shawnee or as Topeka. So think about some of those things. Don't look just at what's happening in Kansas City. They're a lot bigger than we are. Look at other places. Look at other things that are happening. All right, I will leave it at that. But I appreciate you listening because I am getting very tired of this. I have a brother that is mentally disabled, and so I care for him. He's 65. He has COPD. He cannot breathe with a mask, and yet we go into places. Where's your mask? Where's your mask? Well, come on. He can't wear one, okay? I can't wear one for more than 5 minutes, and I don't even have a health problem. I feel like I'm suffocating. Think about a girl who may have been raped and had a hand put over her mouth. Is she going to wear a mask? Probably not, because that will trigger some real memories, guys. Have you even thought of that? Think about those things. Talk to people. If people want to wear a mask, let them wear a mask. But people who cannot or don't want to shouldn't be limited from going to a store to buy the essentials. I have to take him to the grocery store. We now go out of county to do that because I am tired of people coming up to him. Where's your mask? And he's mentally disabled. He doesn't understand it. I mean, he lives alone because we have somebody come in and look at it, take care of him, fix his meals. But for people to come up and harass people like that, it's getting way out of hand. And I think it's because we have these stupid things that are being mandated. Okay? Thank you.
Thank you.
Hello, I'm Phyllis Setchell. It's kind of hard to hear in here, so it's been hard to hear various parties and even hearing with your masks on, for sure. But there are some things that concern me about all of this, and I've spoken before about it. Can you hear me? Because I can't tell if this is getting out. One of the many things is to look at the overview of what's going on in America, and there's a broadcaster or show, Steve Dace, who said he spent days and days going over CDC's statistics, numbers, everything, and then coordinating them so that you understand how they interact. And these are what he came up with. It says 85-year-olds are just 3.2% of the U.S. population, but 1/3 of the COVID-19 cases. 75-year-olds are just 7% of the U.S. population, but 59% of the deaths. 54 years and younger are 70% of the U.S. population, but 8% of the deaths through August 1st. And these are all CDC numbers that he was coordinating. Deaths don't even register a percent until 15 to 24 years old. So even then, it's 0.2%. So kids through college, undergrads, have no significant danger of dying from COVID-19, from the statistics and the facts and the numbers. Median age of COVID death is right around 78 years, which is the average U.S. life expectancy. Not a huge difference in life expectancy from year to year. Even Neil Ferguson, when his model failed hugely with the Imperial College that turned out to be false model. Even in that model, he said he established that 63% of all COVID deaths were going to be people that would have died in a year anyway because of pre-morbidities, comorbidities, respiratory failure, cardiac failure, or morbid obesity. That turned out to be the only thing he was correct on. So if we keep in mind, these deaths are coded as death with COVID, not death from COVID. We really don't have a real number of actual COVID deaths and everybody's heard all the reports on how that gets reported. So that is an overview, but Kansas, and we've stated it before, there's a pie chart that was for August and through August 10th. And this is the monthly COVID update graph, and 380 deaths in Kansas from COVID. That is 1/4 the amount of last year's flu season, 2019 to 2020. So instead of 380 deaths, last season's flu was 1,516 deaths. So we have nothing like the numbers that were last year's flu season. This is also a flu virus, but what I'm not seeing is like this chart that was the scorecard for Shawnee County is so general, you can make a score for anything you want out of it. The weekly incidence, number of new cases during a week, that's the criterion. And then the current level is high, 131 to 175. Well, there is a number. Why is there a range? And that index was 4, really high score. And the notes say, these are case counts reported as average of the previous 2 weeks. I would like to see another chart that has actual numbers. And then those numbers need to be broken down into those who are positive, tested positive for coronavirus, and those that tested positive for COVID-19. There's a difference. If you've had a cold or if you had flu shots, coronavirus is in them, and you are going to have a positive test that is not COVID-19. Why is it we can't have a differentiation so that we really know what we're looking at? That would be important. Then the next criterion, trend in incidence, trend in the county incident rate compared to the previous week. And again, this section is saying week, and when you look at the notes, based on weekly value for the previous 2 weeks. That doesn't even, it doesn't match up with what the criterion is. And it says it was high, and the level was mixed last week up. What does that mean? And that was scored 2. Percent positive test is the next category. Percent positive tests out of all the tests performed. And then the current level is moderate, 5.0 to 7.4. Well, what is the percent of positive tests out of all tests? That's, again, that's a, it's not a number, it's a category of many numbers. And so it says this was computed an average of previous 2 weeks. We have numbers, they are listed somewhere. I would like to see them by week, and when you break down, not only is it coronavirus positive, or they tested COVID-19 positive and what the ages are. Because if they're all in the nursing homes, that would make a difference for everybody else that's going around living their lives. And so we're not getting numbers that we can actually understand where we are. And I don't think that's unfair to want. Percentage, the next one is percentage of new cases with no known source of infection. It's high. It's 37.1 to 50.0%. So the percentage of new cases that are not known where they got the infection. But again, are they the corona? If you break that out, you want to know that information with the COVID-19 numbers, not all of them. Or it's not giving us a correct information. And again, that was over previous 2 weeks. Then the hospital capacity, percentage of occupied medical and surgical beds, moderate, 70.1 to 80.0%. Well, we do know everybody's finally had an opportunity to get the surgery they've been waiting for, and so the hospital capacity should be up because we've been waiting a long time for therapies and various things. But this is all put together with our scorecard, and if we had 20 hospitalizations, I'm sorry, that is not going to overload any hospitals. To be moderate in score on that. And again, that's the average of 2 weeks. Public health system capacity stress. That's pretty general. It can mean anything you want. High, it's 2 to 5 red capacity criteria. What does that mean? And it says in the notes, based on a separate capacity scorecard for public health that includes 8 criteria. I'd like to see the 8 criteria. So the total index is 13, which gives a score to make us do things that are based on what? I think we need more information. And something that you can list and know what you're looking at. All the cases do need to be broken down into ages, positive with and without symptoms, so asymptomatic or with symptoms, and which ones are COVID-19 tested and what tests are we using. I couldn't hear most of what Dr. Pizzino was saying with all the noise and plus the train, what the tests are. Sounds like there's varied tests. But we need to know which ones are COVID-19 separate from positive corona tests. In the nursing homes, they should be on prophylactic hydroxychloroquine to prevent them from getting it. There are people doing that, and I would ask that our health department and health official check with the people and the doctors who have already reported that they are successful in the nursing homes, helping people not even have to go to the hospital by using the zinc with the hydrochloroquine or a nebulizer. Anyway, we need that. We need to have our people protected as well as the staff. And the question about the blood banks, I thought that was very good. Why in the world would we not have data that's automatically given to give us that information? It seems like it's something that would be searched out for. So anyway, these questions I feel like would be helpful for the commissioners to make their decisions if we had real numbers. Thank you.
Thank you, Phyllis. All right. Anyone else wish to speak on this matter? Okay, we have a motion on the table. Motion made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 5, administrative communications.
All right. This time we'll allow anyone to speak on Any subject?
Good morning, Commissioners. Linda Oaks from the Health Department. It is my pleasure today to introduce you to Derek Flerlog. He is our new Infectious Disease Division Manager. And it's interesting, we've talked about long-term care facilities this morning. Derek comes with a lot of experience in long-term care, as well as he was a volunteer contact tracer with KDHE, so he already kind of knew how to do that. So we're very excited to have Derek, and lucky that we were able to win him over to the Health Department. So I'll let him say a few words.
I usually just kind of wing it, so me having some sort of prepared speech is new to me. Commissioners and residents of Shawnee County, thank you for having me. My name is Derek Flerlog. I'm your new Infectious Disease Division Manager for the Shawnee County Health Department. It would be remiss of me to not first thank my entire team at Tanglewood Health and Rehab for the last year of my career. Thank you all. Commissioners, I'm excited to be standing here today as part of a vibrant team that remains more committed than ever to battling this crippling virus. I could stand up here and lob statistic after statistic at you, but perhaps I'll save that for another day. What you'll find out about me is I'm eternally an optimist. I can engage in civil discourse without personal attacks, and my interest truly lies in helping people. I want you to know that I promise a transparent, honest, and hardworking division to protect the citizens of Shawnee County. I promise authentic data and tough conversations when the time calls for it. You may see a young face, but I promise you it is one that is qualified and ready to lead. I'm trained as a respiratory therapist and attended Washburn University right here in Topeka. As a respiratory therapist, I am trained in infection prevention and care, adult, pediatric, and neonatal care, intensive care, trauma, emergency care. Could go on and on. Our T's, as we are known, are well-rounded, and I am proud to be one. Being involved in various leadership roles, whether that was as a city councilman at age 25 for McFarland, Kansas, a member of an advisory board or a nonprofit, and now previously the director of a skilled nursing facility or a nursing home, I have learned that almost no decision can be made with unanimous support. Of course, some issues are trickier than others, and some issues elicit more emotion. Nonetheless, the fact remains that you all and me make decisions based on facts and figures and what we see with our eyes. We do this with the hope that we have made the right decision and never truly know until hindsight is available. COVID-19 has added an extra barrier to this by being an invisible enemy. For those in my previous industry, times have been tough. A significant decrease in profit, much like the citizens of our county, state, and nation have felt, extremely limited PPE, and unfortunately death have occurred. People are scared, confused, agitated, and worried about the future, and understandably so. I want to assure the citizens of Shawnee County that I am committed to you and the county and the state. I am always open to questions and listening, not listening to respond, but listening to understand. Commissioners, Director Linda Oaks, and the entire Shawnee County Health Department, I appreciate your belief in me, your support and leadership, and look forward to fighting this invisible enemy step for step alongside you. Thank you.
Derek, welcome aboard.
Thank you.
Thank you.
Thank you very much. Anyone else? Okay. We do not have a need for executive session, so we are adjourned.
You have the resolution? Oh, you are my hero.
It is hard to hear in here.
Planning?
It is. I think we need a PA.
Okay.
Some